So, the first thing we know is that for all of our sophisticated medicine, our clinical care, the incredible amount we spend as individual institutions on healthcare, clinical care actually accounts for only 20% of health comes, as Betsy mentioned, which is astounding when you consider that the United States spends $3.6 trillion on healthcare a year as of 2018, and that's projected to double in the coming years. It's also astounding when you think about all of the work that your hospitals do every time patients walk through your four doors. So, what are all these other factors? Well, they're pretty much squarely attributable to the social determinants of health, to those who don't have their needs met, who are sleeping on the streets, who don't have enough food. For those that don't have their social needs met, their physical health suffers. Now, in a recent study by HMS, individuals who reported having concerns about things like shelter and food and safety were more than 5 times as likely to report having poor health. And government payers are paying attention to this as well. In a 2014 study, Medicare patients living in high poverty neighborhoods were more than 24% likely than their counterparts to be readmitted after care. And in a separate study, having even one of a number of these different social factors almost tripled the 90-day mortality after hospital admission for heart failure. As our hospitals move to value based care, they cannot afford to rely on clinical care alone. And COVID has made this painfully clear, not just to those in healthcare, but to the general population. The research is ongoing and the numbers keep updating. In December, the New York Times reported that Black and Latino communities were at least 3 times more likely to contract COVID than their white counterparts. Now, this varies by region. A JAMA study in Milwaukee found that Black residents were more than 5 times as likely to test positive for COVID. Poverty also matters. Poor patients were almost 4 times as likely to need clinical care.